Smooth 98.1, love music, love life. Welcome back. If you just joined us, you are just in time. It's time for Smooth Health, and today we're talking to an oncologist. Yes, an oncologist, and there are just 80 of them in Nigeria, trust me. We're going to be talking all about cancers, amongst other things, and if you want to be a part of our conversation, well, now is the best time to do that. Please, you can reach out to us on WhatsApp. Send your messages to 0809-444-0981. I have a very special guest in the studio. His name is Dr. Okoro. He is a consultant clinical and radiation oncologist with specialties in malignancies of the breast, genitourinary tract, gastrointestinal tract tumors, gynecological malignancies, prostate malignancy, and head and neck tumors. Now, that's a mouthful. However, he has attended several training courses in the U.S., including the United States Embassy-sponsored Upgrade Medical Oncology course in 2018, amongst other things. I mean, his profile is just, fantastic. And we would love for you to, send your questions in as well. Okay, so like I mentioned, if you want to be a part of our conversation, reach out to us on 0809-444-0981. Our topic today is cancer, what you need to know. Welcome to the show, Doctor.
Thank you very much.
Good to have you here.
It's good to be here.
I mean, when I was trying to read out your bio, I was just stumbling over them. It's so there. Like, before we even dive right into it, oncologists, right? There are not that many in Nigeria.
Unfortunately, yes.
Why so? How so? Why?
It'll be difficult for me to answer the question directly, but I guess the training is a bit tedious, and we have very few centers where these trainings can be done. So currently, I think about 6 training centers in Nigeria. And as part of the training, one may be required to go abroad for some more expert training, if I may use that word. So I think we'll get there. It's an evolving subspecialty. So, so hopefully we'll get to the numbers that we require.
Alrighty, thank you so much for that. Let's just dive right into it real quick. The International Agency for Cancer Research profiled 78,899 deaths out of 124,815 cases in 2020. I must to start with first. That's a lot. I mean, 224,815 cases in 2020 is a lot of cancer cases. However, what do you think is the common cause of cancer?
Thank you for that question. When it comes to causes of cancer, most of the time there is no absolute cause for any kind of malignancy. What we have are risk factors and associations for the malignancies that are more common, like breast cancer, prostate cancer. Yes, there are a couple of risk factors. Being a woman is a risk factor. Yes.
Being a woman
is a risk factor for breast cancer because it'll cause more in women.
Okay.
Being black is also another risk factor because race is a risk factor. Those are the risk factors that you really can't do anything about. But for the ones that you can actually modify would be things like diet. So if you're on a high-fat diet, if you take a lot of processed red meat, it puts you at some risk, especially for colorectal cancers. There are also environmental risk factors. If you're in a highly polluted area, you might come down with cancers that affect the lungs. There could also be workplace. So if you're working in maybe a hydrocarbon plant, you might also be at risk of bladder cancers, for lung cancers. The same applies to cervical cancer, also very common infection, the human papillomavirus. So those are associations.
Okay.
They increase the risk of the cancer. They may not necessarily translate to coming down with cancer.
Oh, wow. Okay. Well, now that you've mentioned breast cancer, I've got a question relating to that. So the World Health Organization, they affirmed breast cancer to be the most common case of cancers, with 22.7% of all cases in Nigeria in 2019. Now, can you give us an insight, into why we have such high numbers and why it's also breast cancer?
For breast cancer, which I guess also, you would, ascribe to other malignancies, the number one would be underdiagnosis, which we have experienced over the years. So now we're having more diagnostic centers, just like we do have in, the facility where I work in Evercare. Detection is on the increase. Then for, in terms of the patient themselves, if you have what we call an extended estrogen window, which is for women that do not get pregnant early, or those that may be on the plus size. Obesity is also a risk factor for these women, and generally there seem to be this acceptance of westernization in everything we do. So our lifestyle seems to be tending more to that of the Western countries, and this also is in the reproductive lifestyle. So we have more women not having kids early enough, so they are more at risk of things like conditions like breast cancer. So some of this may be responsible for the increase, but I think I want to say first is underdiagnosis, which seems to be on the reverse now. We're able to do more of that.
All right, thank you so much for that. Yep. I'm sure that the questions will be coming in right now. So once again, 0809-444-0981 is where you can send your messages to. Yep. Now, away from that, though, let's talk about oncologists in Nigeria. Yes. So I'm curious, would you say that there are enough oncologists to attend to cancer patients in this country? If not, why is that so?
Unfortunately, there are not enough oncologists in this country. Just like you mentioned in the intro, the numbers are less than 100 registered oncologists. It's even less. The number is even lower than that.
Okay, you know what? Let's break it down. How many doctors would you say? I know that there are so many doctors, many doctors. But how many doctors would you say we have in Nigeria?
At least we should be more than 60,000.
60,000. Yes. So 60,000, and then it's like a drop in the ocean, right? 80 to 60,000. So you see?
Yes. It's actually a very it's a special subspecialty, if I may use that word, just because of the training and the amount of work you need to put in to become an oncologist. So unfortunately, like I said earlier, we don't have enough training centers. So hopefully, with new centers coming up and more investment in that area, I think the numbers would peak with time.
But how long do you think it does take? Let's say I was a doctor now. How long would it take me to be an oncologist? With the trainings and, like you mentioned, the special subsectors. Yeah. How long do you think? Because I'm trying to understand how and why we don't have that many oncologists.
Minimum 5 to 6 years to train an oncologist. 5 to 6. Yeah.
Well, I'm glad I'm in broadcasting. I'm joking. Okay, so here's the thing again. So you mentioned that there's some risk factors, right? Yes. You said being African, is a risk factor. Being a woman.
For some malignant.
Yes. Okay, so being a woman as well. And then you also talked about age, for women.
Yes.
Now, let's talk about that age, right? Does age have anything to do with cancer? Does it have to be, do you have to be in your 30s or 40s or 20s to get it?
There are some malignancies that are common at specific ages. So I'm not expecting someone that is 15 to develop prostate cancer, even though it's possible. So yes, age is an important factor. Some malignancies you would find in advancing age. Some you would find at much younger ages, because there are also malignancies that are commoner in children, compared to adults. So age is an important factor. So there is a younger age group, the older age group, even in the teens. Some malignancies seem to predominate in these various age groups. Yeah.
All right, let's go on a quick break. When we get back, we'll do some more talking. If you just joined us, you're listening to Smooth Health on Smooth 98.1. It's powered by Evercare. Stay close.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.
There's nowhere on this earth that compares.
Smooth.
Hey guys, my name is Rachel Kerr, and let me tell you about My Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside suya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in My Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
Lagos jump. Lagos jump.
Smooth 98.1, love music, love life. Welcome back. If you just joined us, you haven't missed too much though, but you have missed quite a bit. You're just in time. We're talking about cancer, what you need to know. We have a very special guest in the studio. His name is Dr. Okoro. He is a clinical consultant and a radiation oncologist with core specialties in malignancies, and there are a ton of them. You know what? In malignancies of the breast, gastrointestinal tract tumors, gynecological malignancies, prostate malignancy, and head and neck tumors. So we've been talking so far about cancers, like I mentioned, and we've talked about, age and other causes of cancer. But I want to move on to the next question that I have for you. So generally, what are the signs to look out for in detecting cancer?
Thank you for that question. The commonest would be an obvious lump. Okay, but not all malignancies will present with a lump. Some would present with what we call constitutional symptoms, weight loss, bone pain. It would really depend on the location of the tumor.
Before you even break it down further, I want us to go back a little bit, break it down for the layman out there, much like myself. So you say malignancy, right?
Yes.
So what does that word mean?
Malignancy just means you have a group of cells that are behaving abnormally come together to form a tumor. So we call them malignant. Malignant means they now begin to invade the normal surrounding structure. So they have not just the ability to form a tumor, they also have an ability to spread to other areas. And unlike unlike benign tumors. So malignant tumors are the ones that cause the problems we don't want. Benign are just the growth that remain in one spot and usually don't have the ability to spread. Yes, grow.
But how can you tell the difference between a malignant and how can a layman tell the difference between a malignant and a benign tumor?
It's simple. The patient would have a biopsy. A biopsy is taking a piece of the tumor itself and sending to the pathologist for processing. They will tell you that this tumor is malignant or the tumor is benign.
So how long does it take to know which one is which? Because now if, like you mentioned, a group of cells, so and it could form as a lump, right?
Yeah.
So how long does that lump form? You know what I'm trying to say, right? Like how long does it form? Does it take months, weeks, years? I mean, how do you know?
It actually takes years. Cancers do not form overnight.
Okay.
So some malignancies may take as long as 15 years to form. So, I mean, for something to form in 15 years, it means that it can actually be picked up early.
It's been dormant.
Yes. Well, dormant or growing, if I may use that word, gradually. So if you want to pick them early, you just have to get screened. So as much as possible, folks should get screened. And when these tumors are picked early, these malignant tumors are picked early, they can actually be cured. So, but the key is picking them up early.
Okay, so I like the fact that you mentioned picking them up early. So that means that screenings are important yearly, weekly, monthly. How
as much as we gift ourselves, things during our birthdays, we should learn to include gifting ourselves screening packages as well, if I may use that word. So lots of centers out there where this is done. There's a very there's a very comprehensive screening program in Evercare, which we encourage patients to come around. Not just patients, anyone that, even if you're not ill, you should come around and screen yourself, because you don't know what you might find. Yeah.
I think the problem generally with people is that the fear that they might actually find something is, but I like the fact that you mentioned that we should gift ourselves,
yes,
yearly screening, comprehensive screening all the time.
Exactly.
Okay, so that means you've already answered my question, basically, how to detect signs for detecting cancers, right? But then, outside the screenings, are there any other thing we should look out for?
Yeah, like I mentioned, if all of a sudden you notice you're losing weight and there's really no explanation for that, because you could be, just having an intentional fast, and you notice maybe you're running a kind of fever that has been persistent for a long time, or you seem to have a headache that just seems to go away, or some complaint, from any other part of the body. You've seen a doctor, your GP, and he has checked and probably treated you a couple of times and it's still persistent. It might just be something sinister as cancer. So you might need to do a bit more investigation to find out why.
All right. Thank you very much for that one.
Yeah.
Also, how often should people go for cancer testing? Now, I know that we talked about, the screenings, amongst other things. And I know I've heard from different quarters that for women, check your breasts, stand in front of the mirror and all of that. But for regular people, it's, for example, let me cite an example with prostate cancer. It's not easy to tell that kind of thing. So how often would you say a person should go for, cancer testing?
For prostate cancer, just like you mentioned, the current guidelines are everyone should get screened at the age of 45. Every man should get screened for prostate cancer. Once you get to 45, you should have the screening done. However, if there is a strong family relationship, so you have a brother that may have suffered from prostate cancer, or maybe a parent, a dad that has prostate cancer, you may need to screen a bit more earlier. The same applies to breasts, even cervix. Screening should be done at a particular age. Once you're 45, probably get some chest imaging as well. For women, they should do the regular breast check once a year. They should get a mammogram done, and also a pap smear for women as well. Once they get to that, once they get beyond the reproductive age, so they're past their teens, they get to their 20s, 30s, they should always check.
Okay, I like the fact that you mentioned a mammogram and a pap smear. So,
Yes.
Those are foreign words, right? Alien words to laymen. So what does that mean?
Okay, a mammogram is just a modified X-ray that is done for the breasts.
Okay.
So rather than focusing on the lungs, which is most of why we do X-rays, this is just for the breast. So it's able to see if there's anything abnormal in the breast. We normally would prescribe it for ladies that are in their 40s and above.
Okay.
For those that are less, they would probably just do an ultrasound of the breast. For the pap smear, that is for cervical cancer screening. So we always advise women, once there is sexual maturity, you get to the age of 20 and above, you should try and make out time once in a while, at least, let's say 30, you should be screening yourself for cervical cancer, because it's very curable and it can be picked up early.
Okay.
Yeah.
I want to talk about the dangers of cancer. But before I do that, I also want to talk about food. Okay, so in this part of the world, earlier on you mentioned a lot of red meat can cause cancers, right? So I had a conversation with another doctor, and this was on a trip while driving. And he talked about the fact that, processed food, canned food, amongst other things, I don't want to mention names or something, so I don't scare people, could cause cancers. So please, could you educate us on that?
Yeah, in the process of making these canned foods, a lot of additives are added to them, and most of these additives have been shown to be carcinogenic. Carcinogenic just means ability to induce cancers. So I think that is the reason why, most of these processed foods may be a risk factor. For red meat, it's very, very specific. There are agents that have been found to be contained in red meat that can cause or increase your risk of coming down with colorectal cancer. So for red meat, colorectal cancer, for other cancers, that would be any kind of canned or processed food, just because of the additives that are added to them. They are not fresh. Some of them have been prepared for years and you now consume them. So the question is, what has been used to preserve these foods? Some of these preservatives may actually not be very nice, if I may use that word, substances. Yes.
Let me cause a little bit of trouble here. So you mentioned canned foods, right? And we didn't mention any brand name, but let's talk about noodles, right? Noodles are, let's call a spade, right? They're preserved because that's why they're known as instant noodles. Yeah. So would you say that such preservatives could also be causes of,
Well, for noodles, I think the only thing I would find as a problem with noodles is their very low fiber content. So that alone is a red flag.
Okay.
Yes, because someone that eats a lot of diet very low in fiber is at risk of coming down with colon cancer. So that may translate to why eating lots. I'm not saying eating a pack of noodles is going to cause, but when noodles is taken as the only meal, it may increase the risk of one coming down with colon cancer, to be specific. Yes.
All right, if you're out there and you would be a part of our conversation, well, you can do that. Call the number 080, not call now, send a WhatsApp message to 0809-444-0981. We're talking about cancer, what you need to know. Our very special guest today is Dr. Okoro. And of course, Smooth Health is powered by Evercare. And we've got a message here from Dyer from Sule. He's talking about why we have very few oncologists in Nigeria. He says, good evening, doctor. In the U.S., medical degree graduates proceed straight into residency training immediately after graduating, and specialist trainings are usually 3 years. Why is the time longer here and the difficulty in training more specialties? Or specialists, rather.
Well, thank you for that question, Dyer. But if you go back to how specialists are trained in the US, you don't just get out of med school and go straight to residency training. Most of them would have bagged the pre-degree.
Okay.
Yes, before going for specialist training. So at the end of the day, you're still looking at the same, time frame. It will take you about 2 years to pick up 2 or 3 years to pick up one degree. With that, you can now go on to become an oncologist, because you don't just train to be an oncologist in the UK. In the US, most oncologists will have a background degree in internal medicine, then proceed to do a 2-year subspecialty in oncology. So it's still 5 years, whether you want to do it in the US or whether you want to get trained in the UK or in Nigeria, yes.
Okay. So I wanted to talk about the dangers of cancer. And you mentioned a few of them. We talked about breast cancer, prostate cancer, colon cancer.
Yeah.
I think first, not to scare people though, but let's maybe define what they are. For example, colon cancer. What is it? What is it about? And then what are the dangers of colon cancer?
Okay, thanks for the question. Colon cancers are malignancies that are located in the colon. The colon is what we refer to as the large intestine. And the large intestine starts from where the small intestine stops.
Okay.
So there's a place called the ileum. That's where the small intestine stops. So the colon will start from the cecum all the way. You have the ascending colon and transverse colon down to the descending colon and up to the sigmoid and rectum. So it's a very long area. So any tumor that is located within that space would be referred to as colon cancer. It can also be tumors that have come from other parts of the body to nest in the colon. So you can have primary colon cancer and colon cancer that is secondary, that's coming from other sites to the colon.
Oh wow.
Yeah.
That sounds like a lot. I've got a few messages here. Let's get to them real quick. Let's see. This one from Maya says, very interesting interview. Please, how much is a full, I think you're going to have to reach out to Evercare personally at the end of the show for that one. But he says, how much is a full screening and what are the best foods to eat? So maybe you should answer the second one. However, he also says colon cancer is said to be the biggest killers of black men. How do we prevent it?
I will start with the second question. What are the best foods to eat? Natural foods are always the best to eat. Lots of fruits, vegetables, foods rich in fiber. As much as possible, avoid, processed food if you can.
Okay.
And basically eat your proteins, take your carbohydrates, minimal amount of fat. You shouldn't, binge on fatty foods because it may also, predispose you to some malignancies. Then I would use that to also answer the second question.
Okay.
To colon cancer, how to prevent colon cancer. Stay away from meals that are not rich in fiber, because meals rich in fiber have a protective effect in the colon, so it reduces the risk. The other things would be, of course, exercising regularly, taking lots of fluid, anything that is going to help increase the time that food would pass through the colon or material passes through the colon would, inadvertently reduce the risk of coming down with colon cancer.
All right, thank you very much for that one. This one is, quite a valid one because we hear people talk about it all the time. It's from Ayomide from Lekki. Ayomide says, good evening, doctor. Is microwave oven a risk factor?
There is no proven evidence that microwave ovens increase the risk of any kind of malignancy. Lots of research, there's been a lot of debate. It's still a very controversial topic, but up to date, there is no valid data to show that using a microwave or owning one increases one's chances of coming down with any kind of malignancy.
All right, thank you very much for that one. Real quick, this last message here says, the orthodox medicine believes once you have metastatic breast cancer, that's about the end, especially if the spread is to the lungs and other parts. He further says, my wife was diagnosed and treated for stage 4 breast cancer in Louth, and she began treatment. But along the way, we met a medical doctor who uses strictly herbs and started his therapy. Now the heavy tumor on her right breast, they couldn't operate on, melted after 3 months. So right now her CA is 15 to 24 and it's still going down. So do you have an answer to this?
I may not be able to explain, why this has happened. I am not an expert in that field of medicine. So, but I'm glad that, a stage 4 disease is actually responding to some kind of treatment, regardless of the type. So,
well, that's good news then. Okay, so before I let you leave, though, what advice would you like to give to our listeners on taking measures to prevent cancer? And while you're answering that, let's also talk about Evercare. Okay, what you do and, how you take care of cancer patients, amongst other things.
Okay. The first thing is recognizing that everyone has a risk of having a malignancy. What we can do about it, enormous. Lots of things we can do to reduce our risk of coming down with this problem. Top on the list is screening. We should form a health-seeking habit. Unfortunately, in Nigeria, I can understand because of the socioeconomic problems, people do not think it's necessary to get screened. Just make out time. Maybe once a year, twice a year, but just do it for yourself. Because when these conditions are picked early, you can actually, be able to cure them. The other things would be, eating right. Eat the right kinds of food, take lots of vegetables, fruits, lots of natural foods. Then learn to exercise is really important. Take lots of fluid and just learn to rest well. In Evercare, the services that are available are very, very broad. Screening for almost every kind of malignancy is available. We run multiple clinics, different subspecialties. It's one of the hospitals that is able to incorporate virtually every field of medicine in one building. So you don't have to move from one hospital to another to receive care. It's like a one-stop shop for everything.
All right. Thank you so much,
welcome.
Dr. Uchenna Okoro. It's been a pleasure. This conversation was very insightful, It's opened my mind to a lot of things, and I'm sure that a lot of people out there have learned a few things as well. Okay, Lagos, there is more to come, though, but I'm trying to imagine that people would like to reach out to you on social media. Yes? Okay,
Yes,
you know
yes.
what? You know what? If you've got questions you'd like to ask, more questions, and you've got... just reach out to us up on WhatsApp and we'll get back to you as soon as we can.
Absolutely.
Smooth Health is brought to you by Evercare, Lekki. And you know what? Thank you once again, Doctor.
Thank you for having me.
Look forward to seeing you again.
Same here.